So, of course, the president also spoke of his experience after he got the jab, which basically gave it a human face, right? But what are they saying, in particular the health minister, about that set target for population immunity?
So, Shahan, just staying again with the president, and you're talking about a human face. Remember, the president did also say that leaders need to lead by example, and this is exactly what he did, as well as Dr. Zweli Mkhize as the National Minister of Health. And while vaccination is a serious matter, there were some lighter moments where we heard the president talking about being scared and looking at this long needle, and how he was very happy to see health workers going ahead of him and getting the jab. But I'm now joined by Professor Glenda Gray from the South African Medical Research Council to tell us exactly how this rollout is going to take place.
Well, it started by making sure that the vaccines arrived here. They arrived here last night at 10:15, 11:15. We immediately sent them to the warehouse to unpack. The people unpacked the whole night and basically either trucked them or flew them to all parts of South Africa, all provinces, so that we could deliver our vaccination program from midday today. And so for the next 14 days, we will be at 18 sites in all the provinces, and then slowly we'll move out into other areas. We'll take into account public-private partnerships, go to private hospitals as well as hospitals, and go to more rural and more primary healthcare clinics. So every 14 days we will move to other parts of the country so that we can make sure that everybody gets access to the vaccine, but particularly focusing on people that have been highly exposed and heavily burdened by the COVID-19, particularly our frontline workers, people working in ICU, and people that are having to interface with COVID patients on a daily basis. So we do want to focus on them as well.
But you're also going to be monitoring the process to see whether there are any side effects and how to deal with that.
Sure. So we know this vaccine pretty well. It's been in over 43,000 people. The A26 platform, it's been in vaccines in Ebola, Zika and RSV, so we know the platform very well. And so we know the disease profile and the side effects. And so we will be monitoring again, because obviously we're putting into 500,000 healthcare workers. So we want to know more about some of the side effects and to explain how many people get headaches, how many people get temperatures, how many people get flu-like illnesses. So it's very important for us to understand what are the safety profiles of these vaccines in an extended population.
But we only received 80,000 doses from Johnson & Johnson. How soon can we expect more doses to arrive?
We will receive 80,000 doses every 7 to 14 days. And obviously we want to hit the ground running. We want to use up our 80,000 samples, our 80,000 doses very quickly. And so we'll get up to 500,000 in 80,000 doses. Obviously what J&J has to do is they are repatriating all the vaccines from all parts of the world. When they get into Belgium, they get relabeled and they get sent to us. And that takes a process. So since a few days, we knew that this vaccine worked on the 29th of January. We put the request into J&J around 14 days ago, and over a 14-day period, we've managed to sort out a logistic framework that brings vaccines from all parts of the world into Belgium to come to South Africa, and that does take a lot of expertise and program management, project management, but also by bringing in these vaccines every 80 days, every 80,000 doses every 14 days, we can distribute them quickly and be agile and make sure that we get the vaccines out in a way that we don't have surpluses lying around in warehouses.
Professor, just before you go, I know you said to me that you're in a rush. When that plane landed in Johannesburg last night with the 80,000 doses from J&J, how did you feel?
I was very moved. It's very emotional. I wanted to cry. We've been waiting for these vaccines. We've been working so hard. The team has been working very hard. We've worked day and night for 14 days, seen that the plane land, seen the cargo coming out, taking it to the warehousing, getting pictures with the packing, seeing it fly out, getting knowledge, getting people saying it arrived at Barra at 5 o'clock in the morning. It just makes you want to weep with happiness and relief that we could do this so quickly.
Thank you so much for your time. And that was Professor Glenda Gray from the South African Medical Research Council.
All right, Ayesha Ismail, thanks for the update. We'll talk to you just after 4 o'clock again.